and welcome to the Comfort Connections podcast. In this episode, Insight for Aging Services Pros, Reimagining Palliative Care for Seniors, we're joined by Dr. Delia Caramonte, founder and CEO of Integrative Palliative Institute. Listen in as we discuss the role of integrative palliative care and how aging services professionals can incorporate this practice to better help patients and family members. Stay tuned for expert insights and practical tips to elevate your practice in serving aging populations. Welcome, Dr. Caramonte. It's a pleasure to speak with you today.
Thank you so much for having me. I'm really looking forward to our conversation.
Let's start with the term integrative palliative care. How do you define it and what advantages does it offer?
Yeah, I love this question because it is so important, in my opinion, to care for people who have serious illness or aging in a whole person way using all of the tools that work. So I define integrative palliative care as whole person care for families facing serious illness using all the tools that work. And what I mean by that is, of course, medications or procedures or radiation, but also acupuncture, mind-body treatments, manual medicine, gratitude, positive psychology interventions, positive reframing. So all of the tools to help reduce physical, emotional, and spiritual suffering in the family.
Thank you so much, Dr. Caramonte, for sharing this information. Can you illustrate how this type of care benefits patients by sharing a client testimonial?
So I had a patient who came to me with an advanced cancer. I was the palliative care physician, and this person said, I want to do this right. I know what I'm facing. I want to live as long as possible, but I understand what's likely to happen with my disease, and I want to do it right. Can you help me? And I loved that interaction because it gave us the opportunity to talk about what was important to her, what it meant to her to do it right, what symptoms she had that were making it hard for her to live life in the way that she wanted to, what she was afraid of, what she was afraid to talk about with her family. And so we used an integrative approach to help her, quote, do it right. And that looked like this. That looked like we used medications to manage her pain. We also used acupuncture. We used manual medicine therapies like trigger point massage to help with her pain. We used for her nausea medications and procedures, and also meditation, guided imagery, deep breathing, acupuncture, acupressure to manage her nausea. We learned together about what was really important to her, and she wanted to explore artistic expression, which she hadn't done before. And so she started painting rocks. And what she did with those rocks, because they were gorgeous, was she started selling them to raise money for her cancer research around the cancer that she had. And so that became a really meaningful experience for her. We talked about gratitude, and she made gratitude lists. We talked about positive reframing, where she acknowledged the things that were hard and difficult in her life, but also saw the flowers, the little blessings that came out of this experience, like her personal growth, how close she got to her children and her spouse, her experiences of meeting new people, of finding her own strength. And so we used all the tools we had to make her life as good as possible and reduce any of the suffering that she was feeling so that she could really get all of the juice and goodness out of life for as long as she had. And honestly, she did do it right. And she had a really satisfying and meaningful last part of her life.
Thank you for sharing such a powerful story. Following an integrative palliative care mindset, what are some considerations for aging services professionals when thinking about incorporating this type of care approach into home care plans?
Yeah, I love that question because I really do think it's important and doable for home care agencies, hospices, and other groups that take care of families facing aging or illness. This is really doable. And it starts with simple things like, what is most important and meaningful to the patient. So rather than simply coming in and doing personal care as though it's a task, really seeing it as a human-to-human interaction, having all of the people come into the home bring their healing presence, because people are healing entities. It's not just medicines that are healing entities. And I think what home care agencies can do is teach everyone who goes into the home how they can build up their healing presence and how they can share that with the patient and the family, and how that becomes part of actually the treatment of the patient and the family. But one of the really important things about that is if you're exhausted, burnt out, frustrated, you can't bring the same healing presence. And so one of the really important tenets in the integrative palliative approach is that the well-being of the practitioner, whether it's a physician or a home care professional, the well-being of that person is part of the treatment of the patient and family, because they need to be filled up so that their empathy is strong, so they can bring their healing presence into the home.
I love how you talk about the healing presence. Continuing with a holistic outlook on integrative palliative care, psychology and mental health seem to be major components. How can caregivers address these components as they navigate care plans for their clients?
I think it goes in a couple different directions. One of them, let's talk about maybe the more medical piece for a moment. That one, I think it's most important, is to make sure that depression and anxiety are actively recognized and treated. And if anybody, someone in the home has a question about could this patient be depressed, to ask them to see their clinician, their physician or nurse practitioner or PA to talk about that, because depression can show up in ways that we don't expect. So sometimes we have a stereotype of depression is a woman who's crying all the time, but it absolutely doesn't have to look like that. Sometimes it can mean agitation or anger or crankiness that wasn't there before. Sometimes it can cause a person to just pull away and not engage as much. And sometimes the family members think, oh, she's, just ignoring us. But it may not be ignoring them on purpose. It may be that patient's feeling depressed. Sometimes in older people, it can actually show up as cognitive decline. So they may suddenly have more trouble remembering things. And people may think, oh, well, then that's just a progression of their dementia. But it could be a component of depression, too. So asking a clinician to diagnose that, if anybody has an inkling that could be going on, I think is really important. That's one side. And by the way, actually talking about depression, other things that are helpful for depression, have evidence for managing depression, are acupuncture, believe it or not. People don't think of that sometimes. There's good evidence for acupuncture in treating depression. And also mind-body techniques like meditation and mindfulness-based stress reduction also have been shown to reduce depression. So getting a whole person plan in place that could involve medications, could involve cognitive behavioral therapy, could involve complementary modalities, I think is important. So that's one side. And then the other side is this idea of mindfulness, which does not mean meditation. It means focusing your attention in the present moment. And here's what I mean by that. Our mind can really only focus in one place at a time. So it can be thinking about the past, as in, oh, why did that happen? Or why did I do that? Or why didn't they do that? Or why did she say that to me? The past. It could be focused in the future, which is often about anxiety. Oh no, what if this happens? What if the cancer comes back? What if mom can't live alone? What if I lose my job? What if? Which causes all kinds of emotional distress. Doesn't help anything. It hasn't happened yet, right? It's all made up. Actually, the future, as we're thinking about it, is all made up because it hasn't happened yet. And it may never happen. So thinking about the past makes us feel heavier and depressed if it's a negative thing. It's over. We can't fix it. Worrying about the future makes us feel more agitated, activates our stress response. And that hasn't even happened yet. So that's kind of made up. The other place our mind could be focusing is in the actual moment that we're in. Like right now, here we are talking together on this call. That's our now. So all of us have things, between you and me, have things happened to us in the past. Sure. Could things happen in the future? Are there things that you and I could worry about? Sure. But if we focus our attention right now on this conversation we're having, it's pretty okay, right? Like usually in the actual moment you're living in, as long as somebody's not chasing you at that moment, the actual moment you're living in is generally kind of okay. And so that practice of noticing when our mind is thinking in the past or stuck in the future and asking it to come back to what's happening right now, that is one of the most powerful ways to reduce distress for not just people who are receiving home care, but for all of us. And so what I ask people to do is put on a little sticky note, past, now, future, and circle now. That's the one we want. Put them on sticky notes and put those around the house. And when you see one, stop yourself and say, ooh, where was my mind? And most likely it was either in the past or in the future. We could spend hours like that and we don't even notice that we're doing it. And then if you notice that, then you can say to yourself, okay, let me use my senses to try to ground myself back in the moment, in the now. So you might say, let's imagine we're cooking. Okay, I see the red pepper, I hear the sizzling oil, I smell the garlic, I feel the knife in my hand. And then your mind might go, yeah, but what if the CT scan is bad? And then you'd say again, no, maybe take a breath. I see the red pepper, I hear the sizzling, I smell the garlic, I feel the knife in my hand. And you just, every time you notice your mind going to the past or the future, just gently, no judgment, gently invite it back to notice what is it that you see right now, what do you hear, what do you feel. The more you practice that, the better you get at it, like any muscle that you practice. And the more time you spend not worrying about the future or ruminating about the past, the more time you spend in the current moment, truthfully, the more peaceful and calm and happier you become. And this works for patients, this works for family members, and by the way, it works for all of us too.
I really appreciate that. Staying in the now, that is so important. Thank you for these insights. To provide our listeners with a little bit more detail, how can home care professionals incorporate integrative palliative care into their daily work?
Yeah, I think that there are so many skills that people can learn. And ideally, maybe they'd learn it at work, but even they can learn it on their own. So there are skills like what I just told you, that idea of past, future, or now. They could absolutely share that with the family or patient. They could learn simple manual medicine skills. If they are licensed to touch patients, for example, they could do a simple hand massage. If it was okay with the organization, they might even use very gentle aromatherapy oils with a hand massage, if that's okay with the work that they do. They might learn simple breathing techniques that can help calm down a patient who's anxious or calm a family member who's anxious, because one of the great things about palliative care is we see the unit of care is the patient plus the family. And that is because you can't have one without the other. So if you want your patient to be calm, but the family is really agitated and anxious, your number one intervention is probably the family, right? Help the family calm down. This will help the patient calm down. And so just even that awareness that you're not there just for the patient, but that you can't cut the family out of the picture, because if they're all wound up, part of your care for the patient is caring for them. Sometimes that's even just the energy that we bring into the room. Anyone who comes into the home, if that person is mad, they just had a fight with somebody, or they're frustrated, or they're running late, and they bring kind of agitated energy into the home, that will impact the family, and it will impact the patient, and it will impact the interaction that they all have. So part of our being really effective in the home is, as I mentioned before, managing our own healing presence, which means maybe taking some deep breaths ourselves before we come into the home. Maybe when you're either washing hands or using a hand sanitizer, focusing all the attention on what it feels like, what's the smell, what's the temperature, what's the feeling on your hands, so that you yourself are getting into the now. And then you bring that energy as you deal with the patient and family. And just, even if you don't say a word about anything, quote, integrative, just doing that, calming your own energy and bringing that energy to the family and the patient, that calms their energy too. That's part of being an integrative, palliative type of provider. So there are tons of different ways. Part of it is understanding the idea, and then there are very specific techniques that if an organization wants to share with their folks who go into the home, there are lots of things that can be taught. But I think really the idea of healing presence and teaching people to be in the now are probably some of the most powerful things.
Dr. Chiaramonte, looking at the evolution of care, I'm curious, how do you see palliative care evolving, and what changes do you hope to see in the near future?
So I think palliative care in general is a widely misunderstood specialty, and one of the reasons that I find it so important to educate everybody, the general public, healthcare providers, about palliative care is that there's a misunderstanding about what it is. People tend to think palliative care and hospice are the same thing. They are not the same thing. Hospice is a kind of palliative care, but palliative care itself often starts much earlier than the time that a person might spend on hospice. So palliative care is just symptom-focused care for the whole family. So meaning the palliative care doctor is not trying to stop a cancer. And even while somebody might be going to their oncologist who might be trying to stop their cancer, the palliative care doctor is there to reduce their physical, emotional, and spiritual suffering. So reduce their pain, reduce their constipation, reduce their nausea, treat their depression, treat their anxiety, help them with coping skills like we've been talking about, and then help with medical decision-making because sometimes there are decisions to make. So it's a totally patient and family focused specialty. So when people hear that, often they think, oh, well, why wouldn't I want that? That's what I feel like. Like everyone who's appropriate for palliative care should want it because it's all about making you feel better, making your life better. But when people think of it as, the thing you get in the last week of life, of course, they feel uncomfortable when they hear about that. So there's a long answer to half of your question, which is partly what I would love to see is that everybody has a better understanding of palliative care in general. And then I really do believe that all palliative care should be integrated palliative care. So what I hope to see in the field is that more people who are providing supportive and symptom-focused care to people who are aging or ill are not just using medications and procedures, but are also just expanding their toolbox a bit to add evidence-supported other modalities like mind-body tools, manual medicine tools, acupuncture, acupressure, when appropriate, when evidence-supported, just so why not, right? If we're there to help people feel better and reduce their suffering, why would we only use half the tools? Let's use all the tools. So my hope is that all home care agencies practice integrative palliative care, all hospices, all palliative care agencies just sort of by default over time are practicing integrative palliative care. Now, that's my soapbox.
I really agree and support your thoughts about integrative palliative care. It would be wonderful for there to be more education and just people to be more open to, like you said, the other tools that are available that can help through this process. As we near the end of our conversation, Dr. Chiaramonte, can you please share any additional tips or resources for aging services professionals regarding integrative palliative care?
Sure. As I mentioned before, caring for oneself as a healing professional of any kind is really part of your toolbox. So we can't separate the care that we give to other people from how we ourselves are showing up in the world. So part of caring for your clients and patients is caring for you. And the question, of course, is, well, what does that mean? Like, that doesn't just mean eat healthy food or exercise, although those are very good things. But one of the places that I think we miss in terms of managing our own well-being is what I called inside stress, or stress that comes from inside our head. And that's the stress that is the negative voices that we beat ourselves up with. Oh, you messed that up. Oh, why did you do it that way? Or other people know more than you, or they don't like you, or all of these negative voices that we all have. We have different ones, but we all have them. Maybe they were voices that we heard in childhood, who knows? But we all come with kind of judgy, negative feelings that we turn towards ourselves. And we also have a tendency to catastrophize things. So a thing happens and we think, oh my gosh, now I'll lose my job, or I'll lose my house, or they'll never like me again, or he'll never talk to me again, when maybe it was just a difficult interaction and by tomorrow he'll have forgotten about it. So that inside stress is, in theory, 100% controllable, but we often don't talk about it. So we talk about, quote, wellness, and we give, a free yoga class and think that that takes care of all of a person's well-being. So yoga is great, but I do think it's also important that we look at and work on the negative voices in our head so that we can reduce our inside stress, which reduces the total pile of stress that we have in life, which makes us more filled up, more able to access our healing presence, more empathetic, and therefore better at caring for people who need us.
Listeners, to view resources, show notes, and access more Comfort Connections episodes, visit ComfortConnections.com. You can also subscribe and listen to our podcast on your favorite app. Thank you for listening and helping older adults live their best life possible.